Hi, I'm Dr. Matthew Sharpe. Welcome to SharpeVision. I'm so glad you're here today to learn about us and take another step toward having the life-changing procedure of laser vision correction. Most people have heard of LASIK and PRK, but have some uncertainty and fear about its limitations and risks. If you're nearsighted, farsighted, or have astigmatism, laser vision correction may be able to help. I hope you'll learn from this video and have a lot of your questions answered. When the cornea has too steep a curve, or when the eye is too long in relation to the cornea, so that images focus in front of the retina instead of on it, that's nearsightedness. And the result is you can see things up close, but the distance vision is blurry. Farsightedness occurs when the cornea is too flat or the eye is too short. This causes images to be focused at a point beyond the retina. If you're farsighted, you have difficulty seeing objects both up close and at a distance. If the cornea is shaped like a football, more curved along one direction compared to another, then images bend in such a way as to create no single point of focus. That's called regular astigmatism, and it results in blurry and distorted vision. The only way to know is to have a comprehensive evaluation. While the vast majority of people who wear lenses are candidates, there are general health and eye conditions that can prevent safe laser vision correction. After your complete eye exam at SharpeVision, we'll discuss all the options. LASIK is short for laser in situ keratomileusis, which basically means to shape the cornea using a laser. In order to see perfectly clearly, the cornea must be the precise curvature for the length of your eye. The extraordinarily precise excimer laser allows me to reshape your cornea to the exact shape you need to see clearly. Prior to the mid-2000s, LASIK could only be done using a device called a keratome, which used a steel blade to cut a thin flap of the corneal tissue. Since then, a laser has been available to create the flap. This has proven to be a more precise and reliable technology with fewer complications than the steel blade. I only offer all laser LASIK in my practice. LASIK is a two-step process. In the first step, I use a laser to create a perfect flap of corneal tissue. Then I use a second laser to precisely reshape the cornea under the flap. If you're nearsighted, the laser will remove more tissue from the center of the cornea, making it flatter. If you're farsighted, the laser will remove more tissue from the periphery of your cornea, making it more curved. Most people have some degree of astigmatism, which is treated at the same time to make the cornea more round. Each of these two lasers takes less than 15 seconds to complete. The cornea then has a new perfect curvature, so you see clearly without glasses or contacts. There are no stitches, no needles, no blades. It's all done with extremely precise lasers in about 3 minutes per eye. The LASIK procedure is truly not painful, and I'll talk you through each step so you know what you're about to experience. For the first laser, you'll feel pressure as the eye is held with light suction while the corneal flap is created, but you won't feel the laser at all. During the second laser, you'll likely smell vapor as the laser precisely changes your corneal shape. As the numbing drops wear off, usually about 10 to 20 minutes after the procedure, your eyes will begin to water and you may experience some burning, but this usually only lasts about 4 to 5 hours. And we found it can be minimized by using artificial tears, Tylenol or ibuprofen, and a cool compress. I recommend that you go directly home after the procedure and, if possible, take a nap. The thought of seeing clearly without glasses or contacts is very exciting. But for many people, the thought of having laser vision correction is scary. It's very important to me to make the process as smooth and easy as possible for you. First, we want you to know as much as possible about the procedure, because when you don't know what's about to happen, it tends to cause anxiety. To help with nervousness and fear, we offer medicine before your procedure to help you relax. I recommend taking this if there's no contraindication. I know that you'll be nervous, and I will gently talk you through each step so that you know what's coming, what you're about to feel, hear, and see as we go. The entire procedure for both eyes takes about 6 minutes. The answer is immediately. Although your vision will be foggy, you'll likely be able to see a clock on the wall or your loved one's face from across the room immediately after the procedure. It's really exciting. By the next day, the majority of my patients see 20/20 on the vision chart. However, the quality and consistency of your vision will improve for weeks as your eyes heal. The goal of the procedure is to allow you to see as well or better without corrective lenses as you saw with them. Most people see well enough to pass a driver's test the same or next day after they have LASIK. However, the quality of your vision, especially at night, will improve for weeks as the cornea heals. With PRK surgery, the recovery of good vision takes longer, but will ultimately be the same as with LASIK. As we age, usually in our mid-40s, the lens inside our eye loses its flexibility and cannot change focus from far to near. This is called presbyopia. When this happens, there's an option called monovision that allows one eye to be focused on objects within arm's reach for reading or computers, and the other eye to be focused at distance for driving or television. While it doesn't suit everyone, it's an option that I'd like to let you see for yourself if you're over 40 years old, so that you might not be dependent on glasses at all. PRK stands for photorefractive keratectomy and is an alternative to LASIK for certain eye conditions or occupational reasons. When PRK is performed, no corneal flap is created. Instead, the thin surface layer is removed so the laser can precisely reshape the curvature of the eye. The results are the same, and the same laser is used to reshape the eye. PRK is recommended most commonly for patients who have thinner than average corneas. We'll discuss your options at length during your exam. It's important to remember that laser vision correction is a medical procedure, and we can't outline every possible risk. Every person is unique, and there are different types of treatment. Therefore, the healing process and level of discomfort can vary. I encourage you to ask lots of questions as we go so you can be as informed as possible about the procedure. A small percentage of people will need additional laser to fine-tune the results. This is called an enhancement. I recommend waiting at least 3 months after your procedure for your vision to stabilize before considering any additional laser. Most people would still see well enough to pass a driver's test during this period, even if the vision isn't exactly perfect. The chance of needing an additional enhancement is about 2 out of every 100 eyes treated. Almost everyone will feel at least a little dryness or irritation for a while after the procedure. It can vary from several days to several months, but will improve and can be minimized by using artificial tears. Similar to dry eyes, almost everyone will see some degree of glare or halos after the procedure. Factors such as age, your prescription, the size of your pupil, and dry eye may contribute as well. The quality and clarity of your vision will improve for weeks to months. Infection of the eyes following laser vision correction is extremely rare. There's actually a greater rate of infection associated with wearing contact lenses. It's important to use the drops as prescribed, keep your follow-up appointments, and call us if you're concerned. Thank you again for choosing SharpeVision. Please continue to ask questions of my team and me as we go. I know that it's a big decision, but I feel confident that you'll be thrilled with the freedom that life without glasses will bring.